All right, so now we're going to go ahead and talk about therapies, okay? So we kind of talked about the background of the information with the first video, and now we're going to move on to therapies and what they are, and as nursing, how does this make sense for you? So the first therapy we're going to talk about is behavioral therapy. So when we talk about behavioral therapy, this focuses on actions and behaviors. It's based on learning theory, classical and operational conditioning, and essentially the goal is to change maladaptive behaviors directly without necessarily focusing on thoughts or beliefs. Okay, and we talk about maladaptive behaviors. Maladaptive behaviors are behaviors that prevent an individual from coping with new or difficult circumstances, problems, or environments. Okay, and then we have adaptive behaviors. So adaptive behaviors are behaviors that allow the individual to cope with their environment in a positive manner. Okay, now there are different types of behavioral therapies. We've got systematic desensitization therapy. This is for for phobias. We have exposure and response prevention therapy for like OCD, exposures to triggers. We've got behavior activation. This is also can help with depression, scheduling pleasurable or meaningful activities to counter withdrawals. Okay. And then we have cognitive therapy. So when we talk about cognitive therapy, before we talked about cognitive theory, this focuses on thoughts, what people are thinking. Okay, so cognitive therapy, again, is focusing on thoughts and beliefs. It is founded by Aaron Beck, which is, I guess it's not necessarily important for you to know. It's important for me to know either way. The goal is to identify and challenge distorted or unhelpful thoughts and patterns that influence mood or behavior. Okay, so cognitive restructuring is like the biggest kind of thought for this. And so when we talk about cognitive restructuring, this is replacing thoughts like I always fail with more balanced thinking. Like sometimes I don't always make the right decisions, but when I do make the right decisions, it's really good. Okay. So like ATA says, it changes distortive thoughts and patterns, which can lead to maladaptive behaviors. Okay. So we're changing distorted thoughts. And then we smush them together and we get cognitive behavioral therapy. So cognitive behavioral therapy is combining behavior techniques or changing actions and adding cognitive techniques and changing thoughts. Okay, so with cognitive behavioral therapy, we're changing thoughts and we're changing actions. Okay, the goal is to break the cycle between thoughts, feelings, and behaviors. Okay, and so when we're talking about cognitive behavioral therapy, the biggest thing that we're wanting to do is the person, and I will highlight this here for you so that you kind of have it. The person must now learn better ways to cope that lead to better patterns of living, which are our behaviors, okay? The CBT or cognitive behavioral therapy involves helping the individual recognize thoughts and patterns that created their current situation and then reevaluate them in the light of current situation and apply new behaviors. And did I just sound like a jumbled word? I probably did. So let's give you an example. Let's talk about what everybody has is test-taking anxiety, okay? So the thought, when we're talking about a thought, the thought is, I'm going to fail this test and there's no point in even trying. The feeling is anxiety and hopelessness. The behavior is avoid studying, procrastination, skipping review sessions, tutoring, not doing work, whatever. And the result is performs poorly, which then reinforces the thought of I'm going to fail this test. Okay? So now we're going to go to the CBT approach. Okay? So our cognitive therapy approach. The cognitive thought, the thought that we're going to change. So we're going to challenge the thought of is it true that I'll definitely fail? And what evidence do I have? Okay. And we're going to replace It was a more balanced thought of, if I study, I can improve, and one test does not define me. I think I have said that so many times, right? Now, let's talk about the behavior. What is the action? So the action would be to create a study plan with small steps, 30 minutes to review, practice questions, reviewing ATI, practice, questions, whatever. Attending a small group session to reinforce the teaching, uses teach back, blah, blah, blah. Okay? And then what's the action? New thought, I can prepare and do my best. New behavior, studies in manageable chunks. New feeling, more confident, less anxious. The result, improved performance, reduced anxiety. Okay, and so for all of that, you've got the person changed their thought, the behavior was changed, and then now we have a changed outcome. I hope that was helpful. Okay, so when we talk about individualized therapy, this is kind of like, what you think of. One-on-one talk therapy, talking about things that are going on, creating goals that promotes the client's well-being, and then establishing key factors like trust and building a therapeutic relationship. When we talk about group therapy. So group therapy is awesome because it's when multiple clients meet with a therapist, and typically these clients have the groups are based on one specific diagnosis. So the depression could be the one specific thing, anxiety, substance use, grief, PTSD, like a veterans group or something like that. Okay. And then these are phases of group therapy. I don't think that you have to necessarily know this you don't have to know this for my exam. I don't believe you have to know it for, for your proctor. So just review it. Family therapy, review this as well. Okay, so now we're going to go over milieu therapy. So what is milieu therapy? When we talk about milieu therapy, it's a form of psychotherapy in which the environment is controlled to assist the client in preventing and self-destructive or maladaptive behaviors. Okay, so when we talk about milieu, it's essentially a therapeutic approach that uses the client's environment as part of the treatment. Okay, so when we talk about milieu therapy, the environment needs to be safe, supportive, therapeutic, encouraging healthy behaviors, and healthy social interactions. The goal is to help clients learn coping skills, social skills, and responsibility through everyday interactions. Okay? It's really important that nursing helps to enforce milieu. So enforce a milieu environment. The biggest thing that we're talking about milieu is safety. That's going to be gold. Okay. Safety is going to be huge. Structure, clear rules, routines, schedules to help decrease anxiety and promote stability. Support. Encouraging support from staff, encouraging positive behaviors and providing feedback. Social interactions, clients need to make sure that they're practicing communication, conflict resolution, and cooperation, especially in real life circumstances. And a lot of this is if they're in like a controlled setting like a hospital or partial hospitalization or even like an outpatient area. And involvement, clients are encouraged to take responsibility with their treatment. So this means attending their group sessions, making sure that they're participating in activities, helping with tasks on the unit, blah, blah, blah. Okay. And then here is another little table that ATI has put together so that you can kind of look at some of the things that we talked about and have very simple descriptions to them. Complementary alternative therapies, and so these are based in biomedical treatments instead of or in conjunction with traditional medical treatments. They are not approved by the FDA or the Food and Drug Administration for the treatment of mental illness, but they can definitely be helpful. So yoga assists with muscle movement and can improve mood. Exercise can help with improving mood. Meditation, calming to the mind, decrease anxiety. Pet therapy, practice that uses pets to help decrease anxiety. And dietitian, some supplements such as omega-3 fatty acids may relieve symptoms of schizophrenia or depression. Okay, and you do need to know these for exam purposes. I don't think it should take a lot of tough studying to review this information. Okay. Okay, so what does this matter to the nurse? So when we're talking about the different therapies and the nurse's responsibility, nurses are responsibilities can vary based on the type of therapy. Often the nurse will not be performing the therapy, but rather they will not be performing the therapy, but rather collecting initial assessment data, recognizing the client's need for therapy, documenting interventions, evaluating manifestations, treatment progression, and even advocating for clients for treatment. Okay? When we're talking about interventions, nursing is there to reinforce mental health recovery and trauma-sensitive care. Okay, and so what do you think trauma-sensitive care means? So when we talk about trauma-sensitive care, this is essentially when it essentially recognizes that a widespread impact of trauma and integrates this understanding into all aspects. So instead of asking like, what's wrong with you, the provider may ask like, what happened to you? When we're talking about how this affects you in practice, nursing needs to explain each step before touching a patient during a procedure. And so asking, can I touch you? Giving the client option, would you like the door open or closed, light on or off? Avoiding sudden loud noises or unnecessary restraints. Encouraging grounding techniques like deep breathing, sensory awareness, and then using supportive language like you are safe here and you have choices. And obviously nursing needs to make sure that they're using common sense when we're talking about you have choices. As a reminder, trauma-sensitive care focuses on treating the client with an awareness of how trauma shapes their health behaviors and trust in providers. We do not know if people do not tell us that they have experienced or endured trauma in their lives. And just because it's traumatic for you doesn't mean, or just because it wasn't traumatic, a situation's not traumatic for you, doesn't mean it's traumatic to somebody else. We've got big T trauma, little t trauma. Either way, trauma is trauma, and we need to make sure as nurses that we are unbiased and we're taking care of patients with trauma-sensitive care. These are really, really good. This is talking about like psychoanalytical therapy, behavioral therapy, cognitive behavioral, CBT, individual, group, and family and milieu, and essentially what is the nurse's role. Okay, so this is a really good study tool to help you for exam purposes. Okay. And then we're not going to talk about suicide prevention right now. We'll talk about that a little bit later. But it is important for you to understand primary, secondary, and tertiary prevention as it relates to mental health. So when we're talking about primary prevention, this is reducing risk factors, so targeting those who fall in at-risk population. Those are patients that have endured traumatic experiences or traumatic events. certain age groups, family history of mental illness. Secondary prevention is early detection after illness is observed. Remember, they already have to have had the illness in order to be secondary. Nurses can assist with screenings, provide education related to illness treatment, and then tertiary interventions to reduce disabling effects of mental health, which include helping the client develop positive adaptive coping skills and helping the patient to just have positive quality of life. Okay. All right, that was it, and that was enough. And so that is your mental health theories and therapies lecture in 2 parts. I hope you enjoyed, and happy studying. I would encourage you to do the post test to see if you learned something. And that's it.